Hello, my name is Stavros G, and I'm a physicist at the Lawrence Livermore National Lab. Today I'm going to talk to you about our technology for non-invasive in vivo imaging of tissue pathology. In vivo diagnosis of disease is a dream of the doctors and is something that the healthcare system needs. In reality, what is needed is some way of visualizing the tissue microstructure so that the diagnosis would be immediate in vivo and the doctor can take advantage of that. We need to have a technology that provides images of the microstructure in a way that can distinguish between normal and disease. It's a technology that should be non-invasive. It should provide immediate diagnosis. And that will help reduce the time spent in the OR, reduce the number of procedures, improve the therapeutic outcome, and overall reduce the cost for the healthcare system. The technology that we will discuss today involves three main components. One is the system that enables the imaging. The second is the image processing unit, which makes possible the separation of the normal image from the novel histology providing image. And third is the illumination assembly that will make all of that possible. The current gold standard is the tissue biopsy, which involves removing a tissue specimen and then taking it into the pathology, processing that tissue, stain it, cut it into small sections, and then the doctor, eventually the pathologist, will look in a very small area of that tissue. It's time-consuming. The information is not immediate. It leads to repeated surgeries. It leads to anxiety for the patients, increases the cost significantly, among some of the major problems with that. It's time to move forward, move into a new generation of technology. The current gold standard is at least 100 years old. It's probably 200 years old and hasn't changed much, at least for the last 50 years. It's invasive. It's very problematic in general, but it's the best tool we have. So we need that technology that will provide the instant information, something that will provide precise information about the tissue in real time. The feedback would be instantaneous, and as a result, the cost will be significantly reduced, and the therapeutic outcome would be much more favorable for the patient, as well as the discomfort and the anxiety. So this is a problem that has been recognized, and there are many groups around the world that are working towards achieving this. Funding organizations have been heavily investing in this area, and startup companies or established companies are working on that as well. Here we're presenting an example of maybe the most promising system today from Mauna Kea that's called Cellvizio, and it tries to find a compromise between what's possible and what is needed. And the problem is that when you try to look tissue under the microscope, the image is blurry. And that blurring comes from multiple factors which basically involve how the light interacts with the tissue. So that's the problem that needs to be overcome. And the technology so far has been following a method of so-called optical sectioning, which basically rejects all of the photons, all of the light that is out of focus, to keep only the light as it is in focus. And that has a heavy price on the collection efficiency because you reject a lot of the light that you're putting in. Also, they're implementing contrast agents, which is a foreign substance, is a chemical substance. It has lots of trade-offs, including long preparation of the tissue as well as more expense. Probably there would be also issues with toxicity and so forth. Our technology mitigates those issues. Our technology encompasses three main components. One is the UV excitation. UV excitation penetrates very shallow in the tissue. So only a very small section of the tissue that can be matched by the microscope imaging depth is excited. As a result, all of the photons come in focus. Therefore, one can use all of these photons, therefore apply technology that is imaging technology that is highly efficient in collecting those photons into creating the image. This enables the second major component of our technology, which is look to the tissue without any contrast agents. You can use the natural stains that exist in the tissue. The signal is called autofluorescence and comes from intrinsic biomolecules which fluoresce, and they give you a signature of the tissue microstructure. Those Fluorophores are very efficiently excited under UV, and they produce very strong signal. Therefore, we can move away from the stains and use the natural stains that nature has provided to us. And the third is that we can take that image with pulsed illumination, a short pulse, maybe a tenth of nanosecond pulse. That basically will freeze the tissue and freeze any motion artifacts. That will make possible taking high-resolution images when in a living organ, which basically we all know it's always moving, at least at the microscale. So physicians now will have access into in vivo images and tissue pathology. The surgeon, as proceeds with its current methodology, looking through endoscopes or whatever other means, they can switch the system, or they can see in parallel the tissue microstructure. See an example on the right side, where it shows an image from our technology of stomach tissue, and the image underneath is the conventional H&E stain. And you can see the similarity. You can see that you can recognize the tissue immediately. The images are comparable to that of the gold standard, but they are provided immediately. And we believe this is the technology that nature has provided to us to achieve this kind of information. I mentioned to you mostly about endomicroscopy, but this technology is very versatile. One can think, of course, in terms of the in vivo pathology markets for endoscopic or other types of procedures, examining, for example, the tissue margins after resection. But also, one can think of it as rapid biopsy. That means immediately after the specimen is taken out, the margins can be examined very quickly in the OR. So the information, again, is very quick. That would be the ex vivo pathology market. Now, as I said, what we're looking at is tissue biomolecules, which means that we can look at the tissue, about tissue information and tissue changes arising from other issues, such as metabolism. Or we can work with the pharmaceutical industry to develop more targeting drugs. Now, instead of, for example, having to use many experimental animals to get one response curve, we can just use one animal and just monitor it over time. Laboratory animal research, there is a lot of it going on, and we will be able to provide the researchers with a tool to be able to get the pathology information immediately. Now they have actually to take a specimen, which most of the times means that they have to sacrifice the animal. And of course, education. The high schools kids look at slides, they do biology, and now they can have histological information in the classroom. They can look at tissues, they can look at organs, they can look at plants, and all of those things that now are sketched in the book, they'll become real-life objects. The technology is ready to move and excel. We have already a benchtop prototype, which is available for testing. We have done basic research in developing the designing criteria for a microendoscope. Depending on the path to the market, there are lots of capabilities that we can provide and background information to make that successful. Thank you very much. If you need any additional information, please contact Henaro Marfin. Thank you.